Okay, so hello doctors and friends. My name is Stanislav Sultanwangsadinata with the last 3 digits of student's ID 115. And now I'm going to talk about the background of this student project. So these days, problems regarding medicines for pregnancy and breastfeeding is getting higher in the prevalence due to certain factors. In pregnancy, certain medicines could cause the huge risk for both the fetus and the mother that could lead to mortality/death. This also occurs in breastfeeding medicines, which these medicines could act as both the cure and the safety barrier for the mother and the fetus, which will be later discussed more on this student project. That's all from me. Thank you.
Hello, doctor and friends. Let me introduce myself first. My name is Veronica Wijaya with the last digits of my student number 1 and 13. Now we will talk about the problem of formulation, objective, and benefit of research of this student project. So the problem of formulation are what are the problem based on pregnancy medicine, what are the problem based on breastfeeding medicine, and the objective to understand the problems associated with pregnancy medicine, to understand the problem associated with breastfeeding medicine. And the last is benefit of research. Students are able to comprehend the medicine, regulation and uses, prognosis, and alternative medication for both pregnancy and breastfeeding. That's all from me. Thank you.
Greetings, doctors and friends. My name is Sister Natalia with the Trilogy student number 109. I'm going to present about the medicine in pregnancy. There are reasons why pregnant women are special. During pregnancy, female organs change both anatomically and physiologically in order to facilitate the body during the development of the fetus. These changes include all of the body organ systems such as cardiovascular, gastrointestinal, hematologic, and coagulation system, along with the pharmacokinetic properties. Then, changes in pregnant women also occur in her babies, especially during the first trimester of pregnancy, which is the most crucial part of the whole pregnancy period. Because during the first trimester, the implantation to the uterine of the blastocyst will occur in the 5th week. There, the crucial organs of the fetus are developing, such as brain, spinal cord, and heart. Also, at the beginning of the first trimester, the mother body will experience some physiological changes, such as increasing cardiac output because of increasing heart rate and stroke volume, and also an increase in tidal volume of lung, together with the minute ventilation. And for the anatomical changes, mother will have an enlarged uterus along with its increasing capacity. Consequently, there will also be an intra-abdominal pressure which causes the diaphragm to push up 4 until 5 cm, which reduces 10 until 20% of total lung capacity and functional residual capacity. So, in order to improve the health of the mother and fetus, it is important to understand the changes and its impact to the pharmacokinetic qualities during pregnancy. And that's all from me. Thank you.
Hello, doctors and friends. My name is Novain Ratmo, and the last 3 digits of my student number is 119. I will explain about the regulation and uses of drugs in pregnancy. So there are 5 categories based on the teratogenic risk towards the pregnant woman and the fetus. These regulate and set clear guidelines on how healthcare workers can carefully consider and safely prescribe drugs to treat pregnant women. The first is category A. They're completely safe and they have no fetal damage when used. Category B shows minimal risks of fetal damage in animal studies, but there are no confirmed cases in pregnant women yet. So these examples are acetaminophen as a pain reliever in pregnancy. And then there's category C, which shows adverse effects in animal studies, but there is no confirmed cases in pregnant women. This should only be given when the benefit outweigh the risk. For example, using gentamicin to treat severe infections that could have otherwise significantly harmed both the mother and the baby. And then there's category D, which already has clear evidence of human fetal risk, but can be used in emergencies or to treat a severe disease, like using tetracyclines to treat infection if other antibiotics already fail to work. Finally, there's category X, which already have clear evidence of teratogenic effects and fetal abnormalities to both animal and human trials. They are an absolute contraindication in pregnancy, so they shouldn't be used. For example, is thalidomide. That's all from me. Thank you.
Hello, my name is Luis Felixuanda with the last digit of my standard number 117. This time I will explain about the preferences of the drug use during pregnancy. Drug use during pregnancy is limited to essential use because drug use in these periods can lead into both structural malformations and altered organ functions, in the fetus. Antihypertensive drugs are still required to treat patients with hypertensive during pregnancy because the pregnancy-induced hypertension itself exposed to the fetus to higher risk of intrauterine growth retardations, intrauterine death, and prematurity. So still, we need still to treat the hypertension. Usually, we can use labetalol for hypertensive. The prognosis is usually good because it's lower blood pressure without adversely affecting uterine or renal blood flows. However, there is also bad prognosis of labetalol use during preeclampsia treatment. Labetalol use were associated with fetal growth restrictions. Labetalol use also can related into asthma and cardiac failure. The other choice is beta blocker, but this is still need lower studies about its uh, adverse effects. But then the purpose is considered good. The next drugs that usually used is immunosuppressants. Is usually uh, this class of drugs can transfer between placenta. So the drug use should be avoided unless there is a emergency. In a good prognosis, the patient expected to successfully suppress immune response without causing major problems to the fetus. However, adverse effects of this drug still need further studies. At the end, I can conclude that prognosis of drug use in pregnancy is usually related to the fetus. Prognosis is usually called good when it uh, creates the desired effects of the drugs without causing an adverse effects to the fetus. Bad prognosis of the drug use cause several problems to the fetus during pregnancy until its birth.
Hello everyone, my name is Madani Lamrainer Mala with last two digits SOM student number 106, and now I would like to explain about alternative medication for problems on pregnancy. Some drugs that can cause contraindication to pregnant women and fetus are not recommended for use, so that other alternative drugs that are declared safe are needed for use in pregnant women. For example, in the United States, methargine, cytokinone, pitokin, and etc. have been approved for obstetrical indication. Complaints of fever and pain in the body areas are often experienced by pregnant women. Paracetamol or acetaminophen also has been declared safe for use during pregnancy. Paracetamol has been known by the public and is generally used to treat fever and pain in areas of the body. The use of paracetamol during pregnancy is often used to treat pain or chronic pain for various reasons, and several studies suggest that paracetamol causes side effects in pregnancy and fetal development, but the contraindication or side effects are considered uncertain and should be investigated further. Hello, doctors and friends. My name is Jovita Theodora Liu with last three digits 114. Now I will present to you about alternative medication for problems on pregnancy part 2. Another complaint that can be felt by pregnant women is migraine. Migraine is a common complaint during pregnancy. Treatment for migraine in this condition can use paracetamol or acetaminophen. There are several other alternative drugs that are an option to treat this complaint, such as triptans. The use of these drugs must be in accordance with the doctor's direction. Sumatriptan as a type of triptan has become the recommended drug of choice for pregnant women in treating migraine because it is not a major teratogenic agent. As we know, teratogenic agents are not recommended as alternative drugs during pregnancy because they can cause birth defects in the baby. The provision of alternative drugs must be adjusted to the diagnosis and indications in the mother so that safe and effective treatment can be achieved.
Let me introduce myself. My name is Zafira Kumaladewi with the last three digits of student number is 122. Now I will continue the explanation about medicine in breastfeeding mother. It is known that lactation is beneficial both for the baby and mom. For the baby, breast milk can provide the ideal nutrition and antibodies to protect against illness. For the mom, it can lower risk of breast cancer and improve bonding with their baby. According to Indonesian law on health, exclusive breastfeeding must be given for 6 months. But at the time, there were some mothers who had to take medication for their diseases, whether it is a short-term medication like fever and a runny nose, or long-term medication like high blood pressure and diabetes. In general, most of drugs are safe, so the administration of drug doesn't need to be avoided, but the risk and benefit must be reviewed. Some of the drug can affect the amount of the breast milk production, and the drugs can be secreted into breast milk, so it can affect the baby too. So administration of drug for breastfeeding mother must be considered whether the drug can flow into the breast milk or not. If the drug can flow into the breast milk, it must be considered how much concentration that flow into breast milk so it can lower the side effect for the baby. For instance, analgesic drug like aspirin and analgin should not be consumed by breastfeeding mother because it can secreted into the breast milk and affecting the breast milk quality. Another example is anticonvulsants, drug that used to treat seizure and mood disorder like phenytoin and carbamazepine. It can cause side effects for the baby such as drowsiness, feeding difficulties, and pure weight gain. Some antihistamine can lead to decreased breast milk production. Breastfeeding mothers still can consume medicine, but with a strict caution and monitor to prevent severe side effect both on mother and baby. That's all for me. Thank you.
I'm Siva with lesson digit 121, and I'm going to present the regulation of medicine on breastfeeding women. In order to maintain the health of the baby, the health of the mother, and the quality of the breast milk must be maintained and considered too. To ensure an upgrade in health of mother and babies, especially at the breastfeeding term, there needs to be a regulation. An education to mother about the use of medicine in pregnancy and breastfeeding is one of the important regulations. Through this education, the risk and the benefits of these medicines can be more understood and help the mother to determine the appropriate medicine for them. One of the appropriate medicine that cannot be missed is vaccines. Things that may be a challenge for this upgrade of the health of the mothers and babies are barriers of promotion and the lack of participation of pregnant and breastfeeding women. Therefore, a regulation of this also has an important role. The next thing to ensure that the regulation proven to be successfully implemented is examining and optimizing. Examining and optimizing our regulation. The regulations are the way to ensure the efficacy and safety of these medicines and treatments. Efforts such as public and professional education, research, and also the role of government and pharmacists to initiate are important to facilitate the upgrade of medicine in breastfeeding. Thank you.
Okay, so greetings, teachers and friends. My name is Abel Manuel Shanipar with last digit number 118 or 118. And I'll be talking about the prognosis of the problems on the breastfeeding. Okay, so here we go. Prognosis. Drugs used on breastfeeding women must be limited looking at the indications and some other contraindications of the drug itself towards the breast milk. Drugs like lithium need rigorous monitoring, and the use of amiodarone may affect the thyroid function for the infant itself. Prognosis for the anticonvulsant drugs like phenytoin can give side effects for babies such as drowsiness and poor weight gain, but it will treat seizures and mood disorder for the breastfeeding mother itself. And drugs used on breastfeeding women are relatively safe for the babies because the dose received from the milk is generally small, but the education and regulation of each drugs must be well understood. Okay, so that's all from the prognosis for the problems on breastfeeding mother. Thank you.
Okay, my name is Agustin Muradina Pratiaksa with the last strategy SS1 and 12. So about the breastfeeding, we need to pay attention while giving them a medication because amount of drugs will be excreted into the breast milk and will be ingested by the infant. For example, migraine, in normal person, we can give them a phenytoin or carbamazepine, but those drugs can cause side effect for the infant. So that we need an alternative medication by giving them a valproate or topiramate, which will be in low level in mother's milk and shown to have no side effect for the infant. Likewise, for the other disease, so we need to caring about the condition both of the mother and the infant. So that's all from me. Thank you.
Hello, my name is Claire Felicia Oden, with the student number 110, and I'm going to explain the last part of this paper, which is suggestions. So the suggestions for this paper is, first one is for the clinicians to have a long life learning mindset, because there are new emerging drugs everywhere and every year. So keeping up with the trend is for the clinicians. And the second one is for researchers to conduct more research on drugs, the emerging ones or the ones we already have, and calculate which one is more safety for the pregnant and breastfeeding women. And the third one is the stakeholders, to make new and updated regulations on the use of these drugs for the pregnant and breastfeeding women, so it can be safety for the mother, the womb, and also the baby. That's it from our group SGD B5, and I wish you well. Thank you.